So there's so many treatment options, and I always talk about this hierarchy in my practice where we start off down here and then we kind of move up, and there's all these things in between, and then ultimately there's oftentimes surgical solutions for patients. And it's rare to jump all the way up to a surgical solution for patients, but occasionally, like with severe pain or something like this, or a fracture, of course, maybe we're moving up there. But usually we talk about some activity modification, which means kind of changing what we're doing. We talk about physical therapy, maybe go over some exercises or some stretches or some very specific things you can do at home to kind of relieve the pain or the pressure or the stress on the back. Beyond that, we talk in my clinic about some injections that we can oftentimes do, and there's all different types of injections that we use in the spine, and it really matters where the pain is coming from, because I see a lot of patients that say, oh, I've done injections, but maybe they've done this type of injection for this type of pain, but we have a new diagnosis and we need to do this type of injection for this diagnosis, because there's all different types of injections that we can do in the back. And so injections are in there, and then there's surgical solutions. And the surgeries on the spine, they come in all different packages too. So there's what I call smaller spine surgeries, where maybe we go in there and do a decompression and it's a same-day procedure and those patients get better. And then there's really big surgeries where we're trying to recreate the balance of the spine with screws and change the structure of the spine, if you will. And so there's the whole array. And then even outside of my practice, I do a lot of counseling for patients, like, maybe I can't do something here with my injections or surgery or therapy, but maybe there's some alternative stuff like the acupuncture or the chiropractor or the massage therapist. And so we talk a lot about that in my clinic too for certain patients. But it's an exciting time to be in spine, because there are just so many advances, and we're still, to be honest, learning so much about how to get these patients better.